individuals observing or participating in the meeting that the meeting is being conducted consistent with provisions of Governor Gavin Newsom's executive order in 2920. Participants listening to this webcast will only be able to listen to the meeting. Anyone interested in participating in the meeting must join the WebEx. Information and instructions are posted on the website. In just a minute, I'm going to have the moderator kind of go over some tips. I will announce when we are accepting public comment on various issues, and the meeting moderator will open the lines as appropriate. I've advised the moderator to allow 2 minutes to each individual providing comments. This approach is necessary to facilitate this meeting and ensure the committee has the opportunity to complete its necessary business. I appreciate everyone's understanding and patience as we navigate this meeting format for our committee meeting today. Before we get started, I would like to ask the staff moderating the meeting to provide general instructions on how to participate at appropriate times throughout the meeting. Moderator, can you give us a little tutorial?
This is the moderator. Thank you. Before we get started, I would like to remind board members and senior staff who are not speaking to please mute their microphones. If I detect background noise during the meeting as a result of unmuted microphones, I will interject with a brief friendly reminder or simply mute your microphone. To facilitate public comment today, we will be utilizing the WebEx question and answer feature. When the committee chair reaches a point in the agenda in which public comment is appropriate, public comment will be requested, and at the direction, I will turn on and announce the Q&A feature. If a member of the public would like to participate in public comment, they must enter the WebEx event through the link provided in the agenda. Members of the public can indicate that they would like to make a comment by clicking on the icon with a question mark within a square located at the bottom center of their WebEx screen. We currently have instructions on the screen, and these will be shared each time for your reference. In the Ask field, typically in the lower right-hand corner of your WebEx screen, members of the public who wish to make a public comment will type, "I would like to make a public comment," and send to all panelists. Any other communication will not be responded to. It's not necessary to identify yourself in order to make a public comment, and I will take comments in the order that they are received. I will call on the member of the public, unmute their microphone, and that member of the public will have 2 minutes to make their comment. They'll be given a time warning, and at the conclusion, their microphone will be muted. And we will move on to the next member of the public who wishes to make a comment. Please note that the Q&A feature is only being used as a means for members of the public to represent that they would like to make a verbal comment. Once unmuted, the member of the public may verbally state their comment. This is not a means to ask questions of the moderator or members of the board. Such inquiries submitted using this feature will not be answered. If any attendees utilize profane names, they will not be called upon to prevent members of the public from being subjected to profane language. While you are free to express criticism or negative views, for the sake of the members of the public participating on the call, please do not use profane language when making public comments to the committee. If you do not have a microphone, please click on the Communicate at the top of your WebEx screen, then select Audio Connection, call in Audio Connection. If you need further assistance, please refer to the How to Join DCA WebEx event guide that was provided with the board meeting link. And at this point, that concludes my introduction for the WebEx event.
Thank you. Thank you, moderator. This is Debbie Veal, and I would like to take roll call and establish a quorum. Members, as I call your name, please remember to open your line or unmute your line before speaking. Cheryl Butler.
Here.
Albert Wong. Albert, you just muted yourself. There you go.
Here. I'm here.
Thank you. Thank you, Albert. Okay, and this is Debbie Veal also. So with the quorum being established, the committee will now entertain any public comment for items not on the agenda. To facilitate this portion of the meeting, as previously announced, the moderator will open the phone line for individuals to provide the opportunity for public comment. You are not required to identify yourself, but may do so. As we open the lines, I would like to remind everyone on the committee that we cannot take action on these items except to decide whether to place them as a future agenda. So what I plan on doing is we'll listen to all the public comment, and then at the end, we'll discuss whether we want these to be future agenda items or how we want to handle any of the public comment made. Okay, moderator?
All right, this is the moderator. At the direction of the committee chair, I will open up the Q&A feature for the public now. Members of the public, if you would like to make a public comment, please click on the icon with a question mark within a square located at the bottom center of your WebEx screen. We currently have instructions up on the slide for your reference. And as a reminder, if a member of the public would like to participate in public comment, they must enter the WebEx event through the link provided in the agenda. I will pause a moment to allow members of the public to indicate that they would like to make public comment. It looks like we already have a few, so I will go ahead and get started. Our first individual is identified as Lori Walsum. I will go ahead and unmute your microphone. All right, Lori, I am going to unmute your microphone. You'll be given 2 minutes to speak. And Lori, you are unmuted.
Hi, Lori Wamsley on behalf of Walgreens. Can you hear me okay?
Yes, we can hear you.
Okay, perfect. Somewhat related to the next agenda item that you have on your agenda related to vaccine authority. I know the board has previously had a number of conversations regarding expansion of technician roles. I'd like to see the board agendize for a future meeting a technician participation in vaccination. We expect to see an increase in vaccination needs for the fall, as well as obviously with the potential COVID vaccine coming out. I think that this would greatly help to support the public as well as the greater pharmacy community. So I'd like to see that put on a future agenda, please.
This is the moderator. I will go ahead and mute Lori. Thank you. I'll move on to the next individual who has indicated they would like to make public comment. Individual identified as Keith Yoshizuka. Keith, I will unmute your microphone in 1 second. Okay, Keith, I'm going to unmute your microphone and you'll be given 2 minutes to speak. Keith, you are unmuted.
Thank you. This is in regards to the SB 159 educational requirements for furnishing PEP and PrEP. In January, the licensing committee voted on and approved allowing and recognizing curricular training of to furnish PEP and PrEP that occurred in the curricular content of pharmacy schools in the state of California. But it was left off of the recommendations to the entire board. So I'd like to raise it again at a future meeting and see if we can get that incorporated into the regulations.
All right, this is the moderator. I will go ahead and mute Keith's line as it seems he's finished with his comment. And now we will move on to the next individual who has indicated they would like to make public comment. Individual identified as Holly Strom. Holly, I will unmute your microphone and you'll be given 2 minutes to speak. You are now unmuted. This is the moderator paused Holly's timer. Holly, you are unmuted if you would like to make your comment. All right, this is the moderator. I'm going to go ahead and mute Holly's microphone again, and we will move on to next individual. Holly, you may want to connect your audio connection through your phone. I will note your name down and make sure that we get back to you once we're through the rest of the comments. So we will move on to the next individual, an individual identified as Sarah. Sarah, I will unmute your microphone and we will, you'll be given 2 minutes to speak. You are unmuted.
Hi, this is Sarah Rozak. I would like to make a comment regarding agenda item number 3. Is now the appropriate time or should I hold?
This is Chairperson Veal. I would prefer that you make your comment when we're covering agenda item 3, unless you're on a time-sensitive situation that you won't be with us at that point in time.
Sure, I'll wait. Thank you.
All right, this is the moderator. I'll go ahead and mute Sarah's microphone again, and then we will move on to individual identified as Robert Stein. All right, Robert, I will unmute your microphone and you will be given 2 minutes to speak. Robert, you are now unmuted.
Okay, can you hear me?
Yes, we can hear you. Thank you.
Thank you. I would just like to discuss a little bit more than what's agendized in item 4 with respect to the CLIA waived tests. And I think that we need to think a little bit more broadly in terms of things like influenza, strep throat, et cetera, to authorize pharmacists with, who are really the most accessible healthcare professional to the public. And again, as a public policy, making that accessibility more common and more available to the public would be beneficial. So I'd like the agenda to basically look at the same topic, but broaden the scope of it beyond what's on current agenda. Thank you.
All right, this is the moderator. I'll go ahead and mute Robert's microphone again. All right, and then we will move on to Holly again. Holly, you will be given 2 minutes to speak. Once I can find you. There you are. All right, so I will unmute your microphone and you'll be given 2 minutes to speak. Holly, you are unmuted.
Can you guys hear me? Hello?
Yes, we can hear you.
Oh, hey, good morning, everybody. I guess mine is an add-on to Bob Stein's in a certain way, but I think it's very important as regular flu season kicks in the fall that pharmacists be able to do influenza A and influenza B tests so that they can help their patients figure out why they're sick. And that's my comment. So if we don't get to influenza A and influenza B today, it would be great to place that on a future agenda. Thank you.
All right, this is the moderator. I will go ahead and mute Holly's mic. And just as a reminder to members of the public, please only use that Q&A feature to indicate that you would like to make a comment. Please don't type in there twice. We will get to you once we go down in order as received. And it looks like that was the last individual who has indicated they would like to make public comments. Committee Chair, would you like me to go ahead and close the Q&A feature?
Yes, please.
All right.
Thank you, Ms. Moderator.
The Q&A feature is now closed.
Okay, thank you, Ms. Moderator. Members, we have received 3 public comments, and there's 3 topics that were brought up. As a reminder, we cannot discuss these topics. However, we can, if you wish to put them on future agenda items, if you agree with the public comments, we can do so. So please unmute your mic as And let me just kind of go through the three topics, and remember to unmute your mic when you want to speak. The first one was expansion of technician duties to include vaccinations. Cheryl or Albert, would you like to see those added to a future agenda?
Yes.
Okay. I agree with you, Albert. I think it would be helpful. Cheryl, I see you unmuted. Are you in agreement?
Yes.
Okay. Agenda item 2, or a consideration for agenda item 2 was SB 159 to review the colleges of pharmacy curriculum, which cover PEP and PrEP training, and to use for the board to accept, approve, whatever the right words are. Is it appropriate for me to ask, is that something that we need to do through the committee, or is that more of a understanding of the current regulation?
With the chair's agreement, I'd like to work with staff offline looking at the language of the current regulation that references ACPE.
Okay. And then if needed, based on your evaluation, if we need to bring it back to the committee to discuss, we can. And if based on your evaluation we don't need to, then we can just report out maybe at a future meeting on what we found. The third item that was brought up was broadening the scope of CLIA waivers beyond what we're going to be discussing today, and that would be for additional tests such as influenza, etc. I don't want to. I think the comment by the public was just to broaden the scope of the CLIA waive test, and I don't want to get in the pickle that we are currently in, where we actually named a specific test. I think their intent is to, in a general statement, broaden it. Board members, do you agree that this is something that the committee should evaluate in a future meeting and put on our agenda?
Albert, say yes.
I'll say yes.
Okay. So, Anne, if you can take notes and try to get those 3 items on our list for future licensing committee meetings, I would appreciate that. Okay, I am now going to move on to agenda item 3, which is discussion and consideration of the legislative proposal to expand the authority for pharmacists to order and administer immunizations approved by the FDA to prevent vaccine preventable diseases. In your media materials are the existing law, which provides the authority of the pharmacist to administer immunizations either pursuant to protocol, which is in section 4052A11, or with the recommendation of routine immunization schedules recommended by ACIP, or Advisory Committee on Immunization Practices. As the nation and California continue to respond to the current pandemic, it is appropriate to determine if policy changes are needed to ensure California's position to readily deploy vaccines once approved by the FDA in response to the current health crisis, and also in the future. As detailed in the media materials, the FDA Center for Biologics Evaluation and Research, CBER, I'm not sure if they call that CBER or CBER, is responsible for regulating vaccines in the United States. Vaccine clinical development follows the same general pathway as for drugs and other biologics. A sponsor who wishes to begin clinical trials with the vaccine must submit an investigational new drug application to the FDA. The investigational new drug application describes the vaccine, its method of manufacture, and quality control tests for release. Also included in the information upon the vaccine's safety and ability to elicit a protective immune response in animal testing, as well as proposed clinical protocols for studies in humans. Vaccine approval also requires the provision of adequate product labeling to allow healthcare providers to understand the vaccine's proper use, including its potential benefits and risks, to communicate with patients and parents, and to safely deliver the vaccine to the public. Under our current law, pharmacists would not be positioned to order and administer an FDA-approved COVID-19 vaccine until either a protocol was established with a prescriber or the vaccine was incorporated into ACIP's routine immunization schedule. On balance, given the safeguards in place in the FDA approval process, including the labeling requirements, it appears appropriate to consider if additional authority should be provided to pharmacists to ensure they are ready to quickly order and administer the COVID vaccine upon approval by the FDA. Subsequent to release and posting the materials for this meeting, AB 1710 was amended. As amended, this measure will establish the authority for pharmacists to independently order and administer vaccines approved by the FDA. The measure was provided to the members and posted on the board's website earlier this week. In attachment 1 is the proposal developed by the staff with my input. The proposal is intended to meet the policy goal of expanding access for immunizations approved by the FDA as specified. I note it is more limited than the approach taken by AB 1710, excuse me. As the chair, I support both the policy goal as well as this proposal, and I note that the broader approach approved by AB 1710 may provide a more immediate access. I would like to open the discussion to committee members, and I appreciate your thoughts on the overall policy direction of the proposal, as well as specifically on the approach offered, including if you believe the proposal provides in the meeting, proposals provided in the meeting may be too limiting, and any recommendation that we may take should be considered by the full board as part of our meeting later this month. So members, Albert and Cheryl, first I'd like to hear your thoughts on the COVID vaccine, if any.
Personally, I definitely feel that it's something that we should be doing. I'm just trying to understand the CLIA certification. Is that still necessary?
The advisory, the ACIP, that one, the Advisory Committee on Immunization Practices.
The Clinical Laboratory Improvement Amendment that says that there's a certain certification. I don't know. I just saw that they say that that was a barrier. So has that changed?
Well, Anne, I'm going to kind of look to you, but I think currently, under our current law, as long as the vaccine is incorporated into the ACIP routine immunization schedule, then we're set. Our worry is that there is quite often a delay from when the FDA approves it and when it gets to the ACIP. Is that correct?
Yes. So based on our understanding, once the FDA approves it, the Advisory Committee on Immunization Practices may consider whether or not a vaccine should be added to the routine or a different immunization schedule. That group does not meet on a daily basis. I think that they meet 3 times a year. So the intent of the proposal that was provided in the meeting materials was to allow for pharmacists to begin ordering and administering in advance of ACIP approval to meet the overall policy goal as we understand it, which is to ensure that pharmacists are ready and easy to deploy as one of the healthcare providers that is administering the COVID vaccines once approved.
Well, I certainly would support that.
I think, Anne, the difference between the proposal that we worked on and the an AB 1710 is the proposal we worked on focused more just on COVID, whereas the AB 1710 is broader. Is that a correct assessment?
So I think that both would allow for beyond COVID. I think that the context of the conversation is COVID because that's what's really happening right now. But I think both would allow for the deployment by Pharmacist for any of the approved vaccines moving forward. Where I think the big difference in the approach taken by 1710 versus ours is that there are no qualifiers or conditions other than FDA approval under AB 1710. So as soon as it's approved by the FDA, pharmacists could begin ordering and administering the vaccines. The committee proposal in the meeting materials is a little more limiting in that the only way for immediate deployment would be that the FDA recognizes pharmacists and authorizes pharmacists to do it as part of the approval process, or once the ACIP has published that it intends to review the vaccine. So there would still be, in my opinion, there would still be potential delays in pharmacists moving forward with ordering and administering under our proposal. But I do not believe that that would be true. The same could be said for AB 1710. I hope that answered your question.
Yes, it does. And I guess, do we think that we need to modify the proposal we had to mirror maybe what 1710 describes? Because I think 1710 does bring up, I mean, I do like the broadening the scope because I think inevitably what, we originally put together has is a little bit of a limiting factor to it. Like there will be a delay, a potential delay, unless, FDA specifically calls out the pharmacist can administer, and I'm worried that that might not happen. So
Yeah.
Go ahead.
Yeah, so I think that that's the kind of the part two of your question, for the committee is which approach do you feel is more appropriate? And then so the direction to staff and the committee's action could potentially be that, you ask, that we expand the current proposal for consideration by the board.
And I think, Cheryl, that's where you were going. Is that correct?
Yes, absolutely, yes.
Albert, are you comfortable with that?
Yes. Can you hear me?
Yes, we can.
Yeah. I think once the FDA approval, I think they should treat it like any other vaccine. Pharmacists could, administer other vaccine. They should able to administer the vaccine also.
So do one of you guys want to make a motion?
I'll make a motion that what let's see.
So that we want to modify the proposal that's in our, broaden, I guess is a better way of saying, our proposal that's in the meeting materials
So
in attachment 1.
Yeah, to coincide with AB 1710, is that it?
Yeah, and then we'll present it to the full, we'll recommend to the full board.
Yes, that's my recommendation.
I second it.
Is that worded well enough for you, Anne and Noreen?
I think that's right. Essentially, it's looking at the proposal, and instead of having where it's split out now into A1 and A2, essentially it would just be A, and it would simply say to independently initiate and administer vaccines that are FDA approved.
Okay. And so
That's
this would actually, in effect, impact more than just the COVID vaccine. This would impact all future vaccine, which is, I think, is the intent that we had when we were trying to pull this together, because we don't want to be short-sighted and only impact just COVID, because there could be other things that come up in the future.
Right. I don't, as Anne explained, I don't think how it is written now, it is limited to COVID at all. It is just circumscribed by, in the way that Anne described it, either being FDA approved and FDA says pharmacists can administer, or FDA approved and it's being considered by ACIP.
Okay,
So that's how it's, those are the parameters as it's written now.
Right, but that's not what Cheryl's proposing.
Right, right. So what essentially you're proposing is, instead of those parameters, it would simply say independently initiate and administer vaccines that are FDA approved.
So are we then actually maybe instructing staff to modify the language to align with 1710?
Yeah. So I think that, so what I'm understanding it to be is that we're going to be modifying the proposal to take an approach that's consistent with the approach taken by AB 1710. What I would like to ask, and I'm assuming that that includes then also a recommendation to the board for approval of the proposal. I would ask that the chair of the committee and the committee itself also provide staff with the flexibility to work with the chair in advance of the board meeting in July to make sure that we have accurately captured the will of the committee.
Yes.
And the reason why I'm not specifically referring to 1710 is because 1710, as it reads today, may be very different than as it reads tomorrow, for example. So that's why I was just spelling it out in as to what the policy was that you're describing.
Okay, very good. Albert, would you like to second that motion?
I already did. I second it.
Oh, sorry. Okay. Okay, with the motion and second on the floor, I would now like to open the discussion for public comment. Moderator, will you please open the lines as appropriate?
All right, this is the moderator, and at the direction of the committee, I will go ahead and open up the Q&A feature now. Members of the public, if you would like to make a public comment, please click on the icon with a question mark within a square located at the bottom center of your WebEx screen. We're currently sharing instructions for your reference right now. And I will pause a moment. Oh, and we do have a couple individuals who would like to make a public comment. Give me 1 second while I find them in the attendee list to unmute them. So our first individual who has indicated they would like to make public comment is identified as Danny Martinez. Danny, I will unmute your microphone and you will be given 2 minutes to speak. And
Hi,
now you are unmuted.
Thank you. Danny Martinez with the California Pharmacists Association. First off, I want to say AB 1710 is CPHA-sponsored bill, so this is our bill that we have been working with Assemblymember Wood on. So we appreciate the fact that this discussion is moving in a way where you guys are supportive of this. May I make a slight suggestion just to not further complicate things if the committee chooses to do so? Instead of having a separate motion for a separate proposal, would the committee be interested in possibly taking a support position or referring to the Ledge Committee to take a support position on AB 1710? What we would not want to do is have competing measures at some point in the future and just kind of further murky or muck up things. So that would be our comment, but we, again, are thankful that you are supportive of this concept, and that would be our request.
Hey, thanks, Danny. My only thought is, as Noreen indicated, is we know what 1710 is today, and we can and I think maybe we make a second motion to let the Ledge Reg Committee know that we support it. But I think we would want to continue on with our motion just in case it would change.
Understood, and we're fine with that. I guess my only concern is that since Ledge Reg is meeting tomorrow, would this be possible for the full board to take a position on at the July meeting? Seeing as how your next meeting will probably be after the legislature's adjourned.
Chairperson Veal, with your approval, I'd like to just take a minute to quickly respond. The first is that I do not believe that the committee can take a position on the legislation itself because it's not agendized. The bill recently came into print and it was after the agendas had been posted for both this committee as well as the Legislation and Regulation Committee. What I would suggest is that the committee consider, its current motion and recognize that board staff is aware of the policy of the board and consistent with the board's policy with respect to establishing positions on legislation in between committee meetings. The board staff will use some of the preference being stated here when looking at whether or not a position can be taken on the measure using the board's current policy.
Understood. Thank you very much.
All right, this is the moderator. I have muted Danny's mic, and we will move on to the next individual who has indicated they would like to make public comment. Individual identified as Sarah Rozak. Sarah, you will be given 2 minutes to speak, and I will unmute your microphone now.
Hi, this is Sarah Rozak with the National Association of Chain Drugstores, and I just wanted to echo off of Danny's comments as well that we're very supportive of AB 1710 and appreciative of Assemblymember Wood's leadership in developing that. And we just wanted to comment specifically on the use of the word approved and suggest that we look to instead use the word authorized, which would allow pharmacists the opportunity to provide vaccine when it's in the investigational phase as well as when it's approved. It's very likely with the pandemic that when the vaccine has been authorized, it may be distributed to special populations such as first responders or high risk, high priority groups. And that is a time in which pharmacies and pharmacists could be extremely helpful to offer the vaccine to the public. Additionally, we wanted to share the importance, especially during a pandemic, but in other times as well, to leverage all members of the pharmacy staff. So that would include pharmacy technicians and also pharmacy interns. And we believe that pharmacists should have the opportunity to delegate such tasks like the administrative task,
30 seconds.
The technical task of providing an immunization, so including the whole pharmacy staff. And then finally, we just wanted to say that CDC is relying heavily on pharmacies for vaccine planning. And when you use pharmacists and the full pharmacy team, as well as they can be leveraged, you can vaccinate the entire public 7 weeks earlier than if you had not. Thanks so much.
This is the moderator. I have muted Sarah's mic as 2 minutes have gone up. And we will move on to the next individual who has indicated they would like to make public comment.
Can I just make a comment based on Ms. Rozak's comments? And she mentioned interns and technicians. I think interns already have the authority to do immunizations, and that would be included in this proposal. Is that correct?
I would want to confirm with our counsel, but yes, I believe that that is the case under California law. An intern can do anything that a pharmacist can do.
I would have to check that. I would have to check that, and and I can try to do that while you guys are talking, but I don't know off the top of my head.
And technician, I know, we've already acknowledged is a future opportunity that's on a future agenda. The other thing is I'm looking at AB 17, and it specifically says vaccines approved by the FDA. What is do we have, Ann, any kind of a position around pharmacists being involved in, she suggested approved versus authorized. I don't know, if that, in this scenario that perhaps it would be used for first responders before it's approved by FDA. That almost sounds like it's part of the study. And so do pharmacists have any kind of ability, during a clinical study to provide vaccines, under a protocol? So I'm wondering if we need to make a change.
So at the staff level, I think I'd like the opportunity to look into the matter a little bit more. I'm thinking that perhaps it would be under the conditions of an EUA or something along those lines that the FDA has been issuing to allow for things to be used in advance of formal approval. But I'm not an expert in this, so I would like a little bit of time to research that.
Okay.
Thank you.
Yeah, perhaps if we could, research it and have it as part of our follow-up when we report to the board.
Yeah, happy to do so.
If you could allow the next public comment.
This is the moderator. We'll continue with public comment. And just as a quick reminder to members of the public, if you could just please type in that you would like to make a comment once, we will get to you as we're going in order of comments received. So our next individual is identified as Lori Walmsley. Lori, you'll be given 2 minutes to speak, and I will unmute your microphone now.
Thank you, Moderator. Lori Walmsley on behalf of Walgreens. I'd like to first off thank the board for agendizing this important topic. We very much would be in support, Walgreens, of this edition, and feel like this is definitely a needed step to make sure that the public is able to get the vaccine as quick as possible once it's approved. I would echo the concerns with potentially having two bills floating around the session. So I hope that the Legislative Committee will be able to address this potentially to reconcile between the two committees soon. Thank you.
All right, this is the moderator. I've muted Lori's mic, and we will move on to the next individual. The individual identified as Stephen Gray. Stephen, you will be given 2 minutes to speak, and I will unmute your microphone now.
Thank you very much. On behalf of the California Society of Health System Pharmacists, we would like to express support for the board's policy position. Timing is everything with this pandemic, and as soon as a vaccine is available, we need to be ready to go forward. We also support the approach of AB 1710, and the broader approach of FDA approved as the only realistic criteria. I am concerned, however, about 1710 is not apparently an urgency bill, and therefore it would not be law until January 1 of 2021. And so I would also support, we would also support, if necessary, the Board of Pharmacy asking for a waiver. So if we get a vaccine before January 1, we could go ahead and participate in helping to resolve this pandemic. Thank you very much.
All right, this is the moderator, and I have muted Stephen's mic. And at this moment, it looks like that is all the individuals who have requested public comment. Would you like me to close the Q&A feature now?
Yes, please. Thank you, moderator.
All right, the Q&A feature is now closed.
And I think I appreciate the comment by Dr. Gray in regards to urgency and waiver. I know AB 17 was not agendized, so we aren't going to speak to that, but he brings up a great point that, this is something we're hoping to have an effect with the resolution of COVID, and, we would like that to be this year, end of 2020, hopefully beginning of 2021, and not at a point in the future. Can you comment on this? Do we have the authority to make the change to our current regulation, or do we require a statute in order to do that?
So I believe I believe that a statutory change is necessary to expand the authority for pharmacists. Specific to the waiver portion, which I think is what you were kind of talking about, following up on Dr. Gray's comment, is that the board does not have the authority to expand scope of practice through its waiver process. However, as I understand the DCA director authority, it could potentially fall within the authority of the DCA director. Given that, depending on how the board in its totality votes on this policy issue, I do think that once the board stated policy is out there, it could seek to request a waiver under the DCA director's authority. I'd want to research that a little bit more, but my initial thoughts are that if the board already has a stated policy on an issue, we could maybe leverage that policy direction when making a request to the DCA director for consideration.
So should that be a second motion after I understand we need to vote on the one we currently have, but would be appropriate for the committee to also have a motion to, if our first motion is approved by the full board, to direct staff to work with DCA director to obtain a waiver for immediate implementation of our policy proposal? Or is that inappropriate?
I'll have to defer to council on whether or not the agenda item would allow for such action right now.
I think the way it's worded, it's really more specifically toward a legislative proposal. I do, however, think that waiver requests have been made and the executive officer has worked with the board president with respect to wording waiver requests and getting them to the director, and I don't see why that process could not continue.
Okay, thank you. If there's no other public comment, board members, I'd like to vote on our proposal by Cheryl, seconded by Albert, to allow a change in our regulation that vaccines will be, pharmacists will be able to administer vaccines approved by the FDA. We had other language in there giving the staff and the committee chair the ability to kind of, touch base, but we'd recommend this to the full board at our meeting later this month. Can I get a vote? And Albert, can I ask you to vote first?
Yes.
Cheryl, can I ask you to vote?
Yes.
And I also would approve. Unanimously, we'd like to move this forward and recommend to the board, that we continue moving forward. And I would then, based on what I understood council and the executive officer saying, I would also like to make a motion to, assuming upon approval of our prior motion, I would like to have the board, I'm trying to think of the right words, the board president and the executive officer to initiate the waiver process through the director of DCA in order for these changes to be put in place as soon as possible. Do I have a second?
So, sorry to interrupt. This is Anne. I'm not quite sure that we can take action on that, but I definitely hear the committee's preference. But I'll defer to Nori.
I have a comment. I was wondering, I thought that we had already authorized the president and EO to take care of waivers.
Right. This is council. Yeah, I think as we suggested earlier, the issue of waivers is not on the agenda. But since the committee has expressed an interest in that and has already delegated to the board president, who has been working with the executive officer to work on waiver requests, I think the direction is clear. I don't think you need a motion on that, and I don't think it's appropriate to have a motion on specifically on waivers.
Okay, so I guess what I'm just trying to, I'm trying to make sure that it's communicated, because we're voting here for a statutory change. How do we get over the hump so that it's clear that, do we just need to agendize it properly when we have the full board meeting so that we can have the discussion about the waiver?
Go ahead, Anne. I'm sorry.
I think that I think that what at the staff level, certainly not speaking for council, I think that there's already within the purview of the board's policy for a waiver to be requested or granted independent of a full board action based on the delegated authority. And it's my understanding that the committee would recommend that the board president consider something absent a board meeting where something's been agendized.
Okay.
Yes.
All right, so just as long as it's addressed, right? That's all I care about. Okay. Okay, I am now going to move on to agenda item 4, which is discussion and consideration of the pharmacist authority to perform CLIA waive tests for COVID-19. This relates to the authority of pharmacists to perform the tests. The meeting materials in attachment 2 detail all the existing provisions. And I'm not going to read through all the various regulations and statutes that are involved. As indicated in the meeting materials, on May 12, 2020, DCA Director Kirchmeier issued a waiver to allow for pharmacists to order, administer, or collect specimens for COVID-19. As of yesterday, this waiver was extended by 60 days to September 9th, 2020. Along with the waiver, a guidance document was issued that provided additional details regarding the temporary authorities. It is important to note that the waiver does not allow the processing of the sample at a pharmacy unless the pharmacy is licensed as a clinical laboratory and meets all the requirements of BPC 1265. As you may recall, during the June 18th board meeting, members received public comment requesting a future agenda item to specifically address the issue of pharmacists performing CLIA waive COVID-19 antigen testing. The commentator indicated the current situation is rather murky in terms of whether a pharmacist is actually able to perform such a test as they have CLIA waived equipment and reagents. As part of the comments, members were advised that CDPH, California Department of Public Health, has determined that COVID-19 testing shall be performed only in an appropriate licensed lab and under the direction of a lab director. Most relevant to public comment received during that meeting, it should be noted that under the provision of existing law, pharmacists' ability to perform CLIA waive tests are limited to specific tests. specifically as indicated in relevant law portion 4052.4, provides authority for pharmacists' routine patient assessment procedures. However, the provisions are limited to blood glucose, hemoglobin, A1C, or cholesterol tests. These tests can also be processed at a pharmacy if the pharmacy is appropriately licensed by the California Public Health Laboratory Field Services. Aside from the DCA-approved waiver, there are no provisions of law that allow pharmacists to order, collect specimens, or process specimens for COVID-19 tests. Further, pharmacists, unless fully licensed as clinical lab under the Laboratory Field Services, cannot process specimens. Unless members have any initial comments up to this point, we have a couple presentations to discuss COVID testing. Albert or Cheryl, please unmute your mic if there's a comment you would like to make now. Otherwise, I'm going to have us listen to the presentations.
No comment.
No, I don't have any comment either. I will wait. I'm just concerned about the clinical laboratory part of it, but I'll wait.
Okay, thank you. Moderator, we're ready to hear the first presentation. As I understand it, this presentation is going to be co-presented by Danny Martinez from the California Pharmacists Association, along with Sarah Rozak, Vice President of Pharmacy Care and Health Strategy at NACDS, and NACDS consultant Mike Ayotte, who's with Prestige Partners Consulting. Moderator, can you please open the line for these presenters?
This is the moderator. I will go ahead and unmute Danny and also Sarah, and I will also get your presentation up on the screen in just a moment. All right, Danny and Sarah, you are both unmuted. Let me switch over to your presentation.
Great, thank you. Again, Danny Martinez with the California Pharmacists Association, co-presenting here with Sarah Rozak from NACDS. If you want to go to the next slide, please. As was mentioned in the comments by the chair, this is a little bit of the history of where we are. One thing that was not included in the materials, which we would like to discuss, is more the federal impact of items that have occurred. Sarah, do you want to start off with this, and I'll get into a little bit more of the granulars?
Sure. So just to start, OASH, the Office of the Assistant Secretary for Health within HHS, issued guidance that was pursuant to the PrEP Act and Secretary Azar's March 10th declaration that essentially said pharmacists are authorized to order and administer COVID-19 tests, including serology tests, that FDA has authorized. And by using the word authorized, FDA authorized tests, that means tests that were under an emergency use authorization were able to be included in addition to those tests that were then later became FDA approved. And this action qualified pharmacists as a covered person within the PrEP Act that offers immunity in providing these services.
Yeah, and so having that take effect, CPHA and NACDS started working with both the Board of Pharmacy and the DCA executive staff to get some sort of waivers to make this happen. As noted on May 14th, and actually I believe this is wrong, I put 14th, it was May 12th that the waiver went into effect at the Department of Consumer Affairs executive level. Just as a side note, that did get reauthorized as of yesterday. And as mentioned, this allows for COVID testing, specimen collection, and independent ordering of the test. But what we want to, again, highlight is the processing of these tests is explicitly not authorized through, and DCA nor the board have really authority to allow pharmacists to do such things. That is, as mentioned, under the purview of the Department of Public Health. I did want to point out this stat that we did get through NACDS is that there are currently about 3 test sites available per 100,000 people today in California. And with the over 18,000 community pharmacists in both the chain and independent setting, that's a lot of testing that could be occurring right now. Next slide, please. So getting into the CLIA portion, and for those who are not familiar, so the tests that are coming out for COVID right now, the point of care tests are CLIA, they do require a CLIA certificate. And just so everyone is clear, we have had members of ours apply for CLIA certificates, recognizing the PrEP Act declaration at the federal level. We have submitted, our members have submitted requests to the Department of Public Health for CLIA waive and have been actively denied, and continue today to be denied under that. So even at this point, if there are any pharmacies, whether chain or independent, that are doing any sort of testing, it is strict. It is limited to the specimen collection, and while that is great and we do support that, it does still cause a slowdown of the testing itself. A lot of places are just limited to waiting, for the labs. Labs right now are very impacted, and delays are increasing every single day. And so, the requirement for pharmacists to still, contract with some sort of laboratory director it's really cost prohibitive and difficult, especially for the community pharmacy, smaller community pharmacy settings. Next slide, please.
And Danny, if I could add something here as well too. Just for a comparison, New York had a similar laboratory requirement that was pretty difficult for pharmacies and pharmacists, and created some problems related to CLIA waive tests. But their governor actually issued an executive order that waived all of those requirements that were within the public health law that created a problem, that then allowed the pharmacist to do end-to-end COVID-19 testing, as a nice example of another state with a similar issue that we could potentially look to.
Next slide, please. So again, to reiterate, so on May 19th, the HHS Office of the General Counsel issued an advisory opinion, which we do recognize is a non-binding, non-enforceable opinion. However, it is the opinion of the federal government, essentially, that any state or local requirement that effectively prohibits pharmacists from ordering or administering COVID testing is inconsistent with the PrEP Act declaration. We have linked the federal statutes and the advisory opinion on this slide. All the members of the board and the staff should have access to that. Sarah, do you want to add anything else to this?
Just one other point, that by our counts at this point, at least 42 states have taken action to make sure that pharmacists can do end-to-end testing. Of course, as Danny said, this advisory opinion really does say that that the guidance preempts state or local law, and pharmacists should be allowed to do end-to-end testing. So the number of states left that still aren't allowing it is pretty small at this point.
Next slide, please. So what essentially are we asking? So we know that the board obviously can't issue an executive order. That's limited to the governor. We are asking the governor to sign an executive order to remove the existing lab barriers that's preventing pharmacists from conducting full COVID testing. We've heard the governor say repeatedly that increased testing is how we're going to get our state back on track. Right now, I believe we have just over 90 sites that the state is contracted with, the various COVID testing sites. For a state that has 40 million people, that is not nearly enough. Considering how many pharmacies we have in this state, it would only seem logical for us to open up those sites for COVID testing to make that testing more available. And what we're asking really the board and in essence DCA is that we think you guys should be enhancing advocacy and joining us in enhancing advocacy efforts to continue these conversations with the administration to authorize pharmacists to do the end-to-end testing for COVID. Sarah, anything else on this?
Yeah, just one more thing I would add, Danny, too, is that, even though the end-to-end testing is not allowed right now. Our members still have gone through many lengths to try their best to offer testing, and several of them have many locations, mobile sites, drives that they've done, partnerships with diagnostic groups to kind of get around the existing barriers that are there where possible. But I think the overall point that we're trying to make here is that the strength of all the resources that they have and the ability to really help the people of California would be much improved if they could offer end-to-end testing.
And I would also add that, you know, the Department of Public Health has taken the position that these should only be done in laboratory. We should also recognize emergent technologies, right? So as various companies are producing COVID testing, some of these tests are not, you know, difficult at all. They're very, very simple to the point where you can send them home with the patient themselves. The processing of this as you know, is a concern from the department's point of view. We don't think it should be, given that we do have the authority to have those limited testing, which in essence is very similar to COVID testing. So really, there should be no reason why pharmacists should not be doing this end-to-end testing. Next slide, please. And that's it. So I'd be happy to field any questions that the board may have.
This is Chairperson Veal. I have a couple of questions, and then I will make sure that I call on Pharmacist Wong and Butler to also ask their questions. My first question is, Danny, early on you indicated that a number of pharmacies have applied to be able to perform this testing with California Department of Public Health, and they were denied. I believe you, according to the slide, did they A, give a reason for denial, and B, was the reason on one of the slides said that pharmacists are not defined as lab directors?
Yes.
So just kind of give a little bit more behind the denial.
Yeah, so the members of ours that have submitted these applications have been denied with essentially that exact wording, is that pharmacists are not laboratory directors, and no other explanation was given. When we reached out to the department specifically on the advisory opinion when it was issued, their position was essentially, well, this is advisory in nature and we're going to treat it as such, and just left it at that. And other than that, we unfortunately have not gotten any sort of indication from the department on whether they would be willing to do this or open to looking at this.
I'm sorry, that's the Department of Public Health.
Yes, I'm sorry, the Department of Public Health.
Okay. And then it sounds like, Sarah, you indicated that 42 other states are doing this, and it sounds like it's running well in those other states. Do you have any anecdotal information about volume or pickup and testing opportunities or anything like that you can share?
Sure, I can start to share a little bit, and maybe my colleague Mike Ayotte could chime in as well. In terms of examples, I mentioned New York quickly just because they had a similar laboratory-specific issue like the lab director issue that's in California that they were able to work through an executive order. But there are several other states that have also taken action to allow pharmacists to independently order and administer COVID tests. Washington State has some pretty good language that could be used or replicated. Oregon also similarly has waived laboratory license issues to allow pharmacists to do this. Similarly, Illinois has expanded the pharmacist scope of practice to allow for CLIA waive tests. So there are several states that have taken actions, and in total we have 42 that have moved in this direction. Mike, do you want to share some specific examples in terms of volume?
Before Mike jumps on, can I just ask you, those 42 states, how many of them are a waiver or executive order as is being discussed in California? Were most of those states already good to go, or I understand New York, definitely was, but the other states, was this already in their regulation statutes, or were quite a few of them a waiver or executive order?
So by our count, 15 states had the authority within existing statute, and the rest of the 42 have COVID-specific testing authority. So that's either by executive order or Board of Pharmacy action or some other specific COVID action.
Okay, thank you. Mike, first off, how are you? Good to hear your voice. Second off, what can you tell us?
This is a moderator. Let me go ahead and unmute Mike's mic.
Mike, moderator, do we have Mike Ayotte unmuted?
I just unmuted him.
Okay, thank you. We're not hearing you, Mike.
Thank you. Can you hear me? Can you hear me now?
We can hear you now.
Excellent. Thank you, Chairman Veal. Great to hear your voice also. I would just say this. Pharmacies are unique animals, as we all know. In a time of a pandemic, many people would shirk from a responsibility of doing testing, and pharmacy has across the nation been running at this issue head on. There have been some roadblocks, as you've heard here today, with small issues around lab directors, but for the most part, pharmacists have remained open, pharmacies have remained open, and have wished to be part of the testing process. I believe that as the CLIA wave testing advances, as I think Danny mentioned, and technology advances, you're going to see more and more of it. What I would say is that states that have embraced broad testing processes, so I'll even use Rhode Island is a great example. Rhode Island had 56 testing sites for a very small population, had 0 counties that didn't have a testing site in it, and really had a tremendous result when it came to the amount of testing per population. New Jersey, the same way. New Jersey had 284 testing sites for their population and still had 0. California has somewhere around 1,200, a little bit over that, and still has 1.5, maybe 1.7 counties that don't have testing sites in them. The ability for pharmacists to be unleashed to be able to do this is really a key piece to fighting the COVID disease. It's the ability for folks, not just now, but in the future, to be able to be tested and understand that they have COVID and know what to do, and then the right steps to take. As I think was mentioned, most of the specimen collection sites going on in California, there's a couple of chain drugstore members that I know that are doing this, but the ability for folks to be able to do that in a clear way will be more and more necessary over time. So I would say that the testing has grown exponentially as the sites have become driven through. Mostly HHS has been the big driver. And now states are realizing that they have pockets where they need to be using those resources that are located in those specific communities, that instead of having to get everyone to that community, you have pharmacies that are there that can take that on. So I would say that any blockage to the CLIA wave process doesn't make any sense because of the CLIA wave process, and what's necessary to get that really covers everything that's there.
Thank you, Mike. Albert, do you have any questions of this around this presentation that you'd like to ask?
Yes. On those state that pharmacy doing the test, what's the process? They just collect sample, or they actually process the test, or what they do? I don't.
So this is Mike. If I could, so today generally what's happening is the majority of the folks are doing a mixed bag of collection, right? So they're either they're acting as a specimen collector, or they're partnering with a lab group to be able to process the test and get it out. The issue with the CLIA-waived testing is those folks that are using CLIA-waived testing, it's just another option for folks depending on how you want the process to work. In the beginning, when it started, there was a criteria that was necessary for not the fact of whether or not you were going to get a test, but when you were going to get a test. We wanted to make sure the most vulnerable population, the first responders, all got testing first, and that really drove a lot of the pharmacies to partner with someone who could go through, collect all that information, make sure that they had the right people that were eligible for testing, and move forward. Now that they're opening up testing across the board for a lot of folks, it becomes really important that there's multiple ways to collect the testing.
So
And if I could add,
so let me finish. So basically, the pharmacist's duty just collect the sample and then turn over to the laboratory to process the test, right?
I think, Sarah, you want to go ahead and do your...
yeah, sure. I can just explain, sort of expand on what Mike had said. So when we're talking about CLIA-waived tests, which are, the tests that have been deemed so simple that they can be done outside of a traditional laboratory, the steps that you would take to order and administer any CLIA-waived test, COVID or HIV, hepatitis C, flu, strep, all the different types of CLIA-waived tests is a very similar process. So you have the assessment piece, the specimen collection, the interpretation of results, which is simple for a pharmacist to follow. In some cases, there might be treatment. Here, there's not. There could be a referral, a warm handoff to public health officials or to others, depending on the results, if necessary. And then there's also the component of data reporting. And so for CLIA-waived tests, the pharmacist would typically do all of those pieces. But for some of the other tests that Mike was talking about, non-CLIA-waived tests, or depending on state rules in different states, there could be a partnership where the pharmacist might be doing one piece of the process, but a third-party lab partner might be doing the analysis or might be doing the data reporting piece. So we've seen it done many different ways, and there are also examples where with tests that the patient can actually self-administer the swab, that the patient might swab it themselves, the pharmacist may have a role, and then a lab partner may also have a role.
Okay, I got it now. Thank you.
Cheryl, do you have any questions you'd like to ask the group? Okay, we'll go ahead. I guess if there's, so just to kind of summarize, your recommendation is a waiver is needed. Oh, sorry, Cheryl. Do you have any questions you'd like to ask the group?
Yes, I was talking. Unfortunately, I guess I hadn't unmuted my mic. I was asking the question about the laboratories. Can you hear me?
Yes, we can hear you.
Okay, so what I wanted to ask them was, so what you're saying with the CLIA-waived test is that the pharmacist can actually take care of the entire process, that there's no need for a lab director?
That's essentially what we're asking to have the possibility to do here in California. There are states, the 42 other states where end-to-end, what we're calling end-to-end testing is possible and available. As I mentioned before, we've been getting reports, and we've seen them, reported in media, that labs right now are completely overwhelmed, and any ability to relieve that kind of burden in order to get patients, tested, figure out whether they're positive, negative, and take appropriate steps then, and to do all that quickly, that's what we're trying to alleviate. I will say not all pharmacies are going to be, wanting to do end-to-end. Some of them are happy with doing the collection specimens, sending off to labs. That's not going to be eliminated for what we're asking.
I see. And in order to do this, for the state of California would require an executive order? That's a question.
Yes. So the executive order is specific to Business and Professions Code 1206.5, which lists the requirements for performing CLIA waive tests. And the big sticking point here is that pharmacists under Business Professions Code 1209, they're not labeled as somebody who can be a quote qualified lab director. And so that is really, if you're thinking about this operationally, if a pharmacist wanted to do end-to-end testing right now, they would have to get the actual test. And right now, the manufacturers of said tests are denying pharmacists the ability to even get these tests because they need a CLIA certificate in order to get the tests. So right now, as mentioned, our members are limited to specimen collection and the independent ordering of these tests.
So,
and if I could,
I have one more question. So even though we are authorized to have the pharmacists, we're in the process of making sure that pharmacists are able to give these tests. We can be giving these tests and then not really having a pathway to quickly get the results for patients to know if they're negative or positive.
Correct. At this point, once the test is submitted to, once the specimen is collected, it's then shipped to the lab, and then the lab is going to take however long it takes to process the specimen.
Right. Okay.
Yeah, that's my problem. I think the lab takes so long. It takes more than a week or two. By the time they get the result, the information is obsolete. So the patient being, if it's passive, it could be passing to other people while they're waiting for the result. So it's very important that the pharmacist could do the test and able to do process the test right away to get the result as soon as possible. So to prevent the continued, stop the passing to other patients, other people. So I would like to see it. We could do it from end to end. So we could test it and we could process the result if we can.
Yes, and I totally, I agree with that, because I know when I took the test, it took 4 days, and I had a friend do the test and had the results back in 1 day. So I think that does make a big difference, the time that you get the results back from the test.
Yeah.
So no more comments.
Okay, and it seems like the current proposed solution is that we need to have an executive order from the governor. But in the meantime, perhaps we need to have some sort of a dialogue with, have our staff start a dialogue with CDPH. Okay, I want to, if there's no more questions from the board members, what I'd like to do is, I believe we have another presentation that I'd like to move on to the second presentation. So moderator, we now have a presentation from Dr. Yoshizuka from California Society of Hospital Pharmacists, who I understand is going to share additional experience and input on this matter. Can you please open up the line for Dr. Yoshizuka?
This is the moderator. I will go ahead and unmute Dr. Yoshizuka's mic.
Thank you very much. Thank you very much for the opportunity. I will say that the availability of COVID testing amongst pharmacies is not widespread. It's has taken a toehold and is making inroads. And as CPH had indicated, there are more folks that were interested. I surveyed all of our alumni and wanted to know if anyone was doing COVID testing. 3 of them responded, said they had applied for CLIA waivers but were rejected, similar to what CPHA had said. Then upon further inquiry, I asked what form did you use, so on and so forth. Turned out they were applying for a full lab. So I sent them back the proper form to use, and that was just yesterday. So hopefully they'll be able to get that and they'll be on board. I spoke to individuals from all over the state in different practice settings. I'll start off with the independent pharmacies. There's a pharmacy in Northern California, independent. He has four stores in Solano County and Contra Costa County. He actually started doing COVID testing before the executive order, doing it through a collaborative practice agreement with the physicians at the Solano County Health Department. They did it at the county fairgrounds and at the health department parking lot, and people just basically drive up. He's got a lot of experience doing this now, and of the folks that I've spoken to, that seems to be the one one of the commonalities. But let me talk to all the other places first. That's Northern California. Southern California has some similar experience with an independent pharmacist there. Sharp Healthcare in San Diego did COVID testing at their Coronado site. They opened a community pharmacy on the island of Coronado, and strangely enough, the reason they did that is because nobody that lived on the island wanted to go off of the island for testing. So when it was available through the pharmacy, they opened it up, and they did several hundred of the tests, which were processed through the Sharp labs. Sharp is the largest accountable care organization in the state of California. Similarly, Ralph's, the supermarket chain, did it at one location in Southern California. They did it 2 days on 2 different weeks, 2 sequential weeks in the month of June, and they did quite a few tests. But they aren't planning any further tests because they were solely billing through HHS, and the HHS authorization for funding expired at the end of June. So if Health and Human Services decides to extend that funding, then they would consider reopening that up again. CVS, to their credit, is doing it at a number of locations all over the state. They're doing it in all of the places, quite frankly, doing it largely using the drive-through option. And it's amazing, all these different people, there wasn't a lot of guidance as to how to do this. So as one of the pharmacists said, it's kind of like the Wild West. You make it up as you go along. But it's interesting that the independent pharmacies, CVS, and Sharp Healthcare, and all these other places, they all ended up doing it the same way. They all ended up doing it through drive-through, and there was a couple different models, but everyone selected the same model where they give the swab to the patient. The pharmacist instructs the patient on how to collect the specimen. So the patient inserts the swab, it's a long swab, up their nostril, and then puts it in the tube, seals in the tube, gives it back to the pharmacist, and the pharmacist sends it off to a central lab for processing. So everyone that I talked to using that model is interesting that everyone came to the same conclusion. So, like I said, CVS is doing this at a lot of different locations using that same model and primarily drive-through. The folks I spoke to at Walgreens hadn't gotten around to it, but they're looking at possibly doing this because they're doing it in other states. So that's pretty much my report. I don't have statistics. It's all anecdotal. I talk to individuals and how they're doing it, and it just amazed me that all of these different settings and everyone decided to do it the same way. Most of the people are doing it just out of the pharmacy. The people in the independent pharmacies, particularly the ones that the one that's being collaborating with Solano County Health Department. Those are the only ones that I know of personally where they've gone out to skilled nursing facilities, because both the pharmacist and the health department identified the SNFs as a high-risk population, and they wanted to get as many of those tested as possible. So that's the end of my report. I'll entertain questions at this point.
Hi, Dr. Yoshizuka. This is Debbie Veal, the committee chair. I believe a lot of the testing that you're describing, with the self-administered swab and is sent off to the lab. So I think that's different than what we're trying to accomplish here, which is actually the CLIA waive, where the pharmacist can actually, perform the lab piece and then be able to provide results back. So, I don't see the pharmacist ever taking the self-administered swab and analyzing that, but I think that there is some FDA authorized or approved tests that, can be used, kind of more like a machine reading and instant example. So, I know, I'm pretty sure Ralph's CVS, I'm not sure about Sharp, and I'm not sure about the independent, but it sounds like they're all doing the test where they're sending, they're doing what was allowed by our DCA director, and that is collecting the sample, but they're not doing anything more than that. Is that correct?
That's correct. I just this morning got an email from Ralph's, and the parent company Kroger is partnered with Boots, and they have acquired a supply of the CLIA waive test. And at this point, they're talking about selling those, and the patient would send it in on their own, or would they do the test at home? Just selling the test, not actually performing it in the pharmacy.
Yeah, okay. This is board member Albert Wong. I just had my test about a week and a half ago, and my experience is that I don't think the ordinary people could able to get their sample themselves, because it's the swab they stick it to my nose is pretty deep. I didn't expect it go that far, so I don't think. If you have those old man, old lady, or somebody who's not familiar with the test, it's pretty hard to get a proper sample and get an accurate test.
And I think that's why they settled on the pharmacist doing the direct instruction. That's everyone that I've talked to so far.
Cheryl, do you have any questions of Dr. Yoshizuka?
I just like what Albert just said about the test that he had. Now, the one that I had was just a swab in the mouth, and that seems pretty simple, but I don't, I'm wondering, is that as accurate as the swab to the nose?
I couldn't speak to that. I'm not familiar enough with the that particular test.
Okay, because I know the swab to the mouth test was relatively easy to do, so I can definitely see someone being able to do that one at home.
Yeah, I agree with that. If it's just swab, then the patient are capable of doing so. But going down the nostril, I think it's a little more difficult for them to do so.
Right. Thank you for the presentation.
Thank you for the opportunity.
Okay, moderator, you can turn off Dr. Yoshizuka's mic. And I think my fellow board members, I think from what I've heard is that there's definitely an opportunity for pharmacists to get engaged in the COVID testing. It sounds like in order to obtain the ability to do CLIA waived testing, that it is going to be cross-jurisdictional. You know, we're going to need to hopefully try to work with California Department of Public Health, as well as, you know, continue, and possibly the governor, because it does seem like the governor is aware of the issue and at this point in time has made a decision, probably based on feedback from that department, to not, you know, pursue an executive order. So I think at this point what we need to do is to ask our staff to potentially, you know, see if there's something they can do to work with the CDPH, they say that, PH, and potentially the governor. I don't know, Ann, if you have any suggestions on how we possibly can proceed here, but there's definitely a need, and we can't just let this drop. We need to move forward, and I think it's really two steps. First off, it's the COVID situation, to try to deal with the emergency, you know, the current situation, but then also figure out, you know, in regulation, you know, how we possibly jump this hurdle. And I don't know, if you have any thoughts, and I know Dr. Yoshizuka indicated that perhaps the pharmacies are filling out the wrong form. Like I'm hearing that it doesn't matter what form they fill out, that they're all getting pretty much denied. Anyway, can I turn it over to you? Can you provide us some thoughts, and then we'll open it up for public comment?
Yeah, so I think I would say that, you know, based on the discussion of the committee, I'm very happy to reach out to sister regulators in the administration and see, you know, talk about some of the support that at the policy level we have, and see if there's opportunities, you know, what those may be, either in terms of some type of an executive order, or perhaps even more long-term, looking at some of the current prohibitions in both pharmacy law as well as other sections of the BMP code. And from the larger public health perspective, are there opportunities to create some different access points for patients that will improve the overall public health for Californians?
And I think maybe as we, you know, we have an urgency because of COVID, but I'm thinking as a future agenda topic, we would open the topic up based on the public comment at the beginning of the meeting to maybe more than COVID, but I think right now we have the urgency of COVID, so I think we would appreciate whatever you could do with the other agency, as well as, you know, the governor and executive order. So before I do open it up to the rest of the public, I just want to also get, you know, Albert and Cheryl to weigh in if they agree that that's probably our best next step. And I don't know, Ann, do we need to make a motion for this, or can we just instruct the staff?
So I think that I have, you know, a good sense of where you all are going. I don't know that a motion is necessary. I would defer to council on that. But, you know, I think that the overall policy goal is to look and see what actions, you know, we can advocate for to expand testing capacity and access points for patients at this point.
Yeah.
Yeah, I think
do you agree that a motion is not necessary?
I agree. I think just you're just directing staff to move forward with seeking out other avenues. I don't think you need a motion.
Okay. Albert, let me do Cheryl first, because I've been doing Albert a lot. Cheryl, let me go to you. Is there anything that you would like to add Or did you think I did an adequate job of summarizing?
I think you did an adequate job of summarizing it, and I would just like to add that this is urgent. You know,
Yeah.
with the lack of places for testing now. So that's the only thing I'd like to add, that it's urgent. Thank you.
I appreciate that. That's a good emphasis. Albert, is there anything you would like to add or emphasize?
I agree with what you guys saying. But like I say, I like to see those testing could get the quick results, so we could do something about it instead of wait for 1 or 2 weeks for the result. Okay, so emphasize on the quickness.
Okay, thank you, Albert. Moderator, can we open up the discussion for public comment?
All right, this is the moderator, and at the direction of the chair, I will go ahead and open up the Q&A feature now. Members of the public, if you would like to make a public comment, please click on the icon with a question mark within a square located at the bottom center of your WebEx screen. We currently have instructions on the screen for reference. And just as a quick reminder, once again, please only submit once if you would like to make a comment, and we will go in the order that they are received. So I have a couple comments. I will go ahead and start with Danny Martinez. Give me one moment so I can get my timer up. Danny, I will unmute you and you will be given 2 minutes to speak. You are unmuted.
Thank you. So again, I want to thank the committee for the discussion here. Really like where this is going. If I could make one final suggestion, if the committee is willing to do so, would the committee consider a policy statement related to this issue to be made publicly, either through your process of voting at the committee level, at the board level? Something I think to really show support for this from a board standpoint, in addition to everything else that was discussed.
All right, I will go ahead and mute Danny's mic, and we will move on to the next individual who has indicated they would like to make public comment. Individual identified as Robert Stein. Robert, I am unmuting your microphone now, and you will be given 2 minutes to speak.
Hi, thank you. Just a few points, and I totally agree with the concept of pharmacists being able to perform not only the COVID test in-house, but other tests down the road. There are several roadblocks beyond just what's been discussed here. The first question really is the problems related to the 4052 series in terms of what's authorized. And it specifically talks about being drug therapy related. We're now talking about potential tests that move into a more diagnostic, but not necessarily drug therapy related domain. So again, I think that there's going to need to be some kind of a statutory adjustment in those areas too. I think the other concern that I have is with the COVID spike reoccurring now, labs being overwhelmed, it's likely that the manufacturers of equipment that do the CLIA waived testing along with the reagents necessary are probably also going to be in short supply. So that's another thing just to keep in mind. And then lastly, remember that these CLIA waived tests that are out there for COVID specifically are just CLIA waived under an EUA, an emergency authorization, which means that they haven't been validated by FDA, and we have heard of many cases of false negatives. Thank you.
Dr. Stein, so I concur with your last statement, but I think we would still want to try to move forward. Do you agree?
Yes, absolutely. I'm just pointing out, some of the practical things beyond necessarily what the board is addressing, from the standpoint of actually getting those tests into pharmacies.
Okay. And I think in regards to the drug therapy related, Ms. Sodergren can correct me, but I believe that Dr. Kirschmeyer her waiver allows us to go beyond drug therapy. I think that's what her waiver is about, correct, Ms. Sutherland?
Yeah, it does remove that limitation.
Okay.
Specifically for COVID though, right?
Correct. But that's all. That's our agenda topic. That's all we're talking about today.
Understood.
Okay. we heard you earlier, so we'll address the other things later at another meeting.
All right, thank you.
Board members, I don't know if you have any, or Ms. Sodergren, if you have any thoughts about a policy statement. I feel like perhaps that's, that is what we're instructing the staff to maybe do a little bit of research and, try to move this forward. Any thoughts, Ms. Sodergren? I don't know if you want to start us off on the advantage of making a policy statement versus, just direction to staff to, work with the department and the governor.
So I don't think that there's a problem, drafting a policy statement, but I think that we need to be mindful that the issue is really not something within our swim lane, perhaps. And so it's really important that we continue to partner with the administration as we move forward. If this was something totally within our swim lane, the board would have, more autonomy. But given that many of the challenges that have been discussed are actually outside of the board's purview, I don't think a policy statement is a problem. But I think that the practical realities are we need to be mindful of all of the challenges with this type of thing. And so advocacy is absolutely appropriate. And if you want to do some of that through a policy statement, that's fine. I do think that some of it might not necessarily be a policy statement, but more, kind of advocacy actions in other areas.
Is a policy statement, like you say, on items that are not necessarily in our swim lane? I guess my gut is I'm a little bit concerned that we aren't stepping on other toes and we're trying to create a camaraderie here and work with other departments. Would a policy statement, potentially be misinterpreted?
I think that that's a little bit hard to say. If the committee would be agreeable to allowing staff to do a little work first and then maybe provide an update during the board meeting, at which time the board could consider a policy statement.
Yeah, okay, I think I think I'm comfortable with that. But Albert and Cheryl, any comments on how we approach it around the policy statement?
I agree with what Ann said.
Yeah,
what you just said.
exactly what I was going to say. I agree with what Ann said.
Okay. Any additional public comment, moderator, since we've just had a short discussion? I don't want to have Danny or Dr. Stein come back up. Has anybody else open it one last time for public comment?
This is the moderator. Yes, we do have, I believe, 4 more individuals who have indicated public comment. So our next individual is Stacy Neroni. Stacy, I will go ahead and unmute your microphone and you'll be given 2 minutes to speak. You are unmuted.
Hi, this is Stacy. Can everyone hear me? Hello, can you hear me?
Yes, we can hear you.
Okay, so this has been a great discussion, and I just want to really quickly throw out some clarifications for some things that I thought were kind of confusing in the discussion so far, to make sure that the board, I'm so happy that the board is going to take this on and look into it more. But first off, there's a difference between a CLIA certificate and a lab license. I know people kept talking about them interchangeably. The CLIA waiver is being denied by CDPH when a pharmacist is listed as the lab director. But if you contract with a physician and have a physician listed as the lab director, the CLIA waivers are being issued, just so that everybody knows that a pharmacy can get the CLIA waiver. A pharmacy cannot get a lab license. Also, I just want to clarify, because people mentioned them a couple of times in the law, it's really confusing. The agencies are sending out information almost every day, and it's different. So please keep in mind that I think that the board is only talking about those tests that are identified by the FDA as waived tests that can be performed with the CLIA waiver. And I believe under the law as it stands right now, if the pharmacy gets that CLIA waiver certificate with a physician as the lab director, they can do end-to-end testing on waived tests. But we should get something going so that the pharmacist can be the lab director on that CLIA waiver and can do end-to-end testing. The pharmacies can do the end-to-end testing themselves with only those waived tests. There are other tests that require a lab license that was mentioned earlier in one of the presentations. And I don't think you're talking about that. And I do think that that would require a lot more legislation from different agencies. I have several community clients that have already started to acquire.
This is a moderator. I have muted Stacy's mic as 2 minutes have lapsed. So we will move on to the next individual who has indicated they would like to make public comment. Individual identified as Lori Walmsley. All right, Lori, you will be given 2 minutes to speak, and I am unmuting your microphone now.
Thank you, Lori Walmsley on behalf of Walgreens. Again, thank you to the board for addressing this very important topic. Just to provide a little bit of context outside of what Dr. Yoshizuka provided, Walgreens is currently offering testing in 27 states. The majority of the testing locations we have are the end-to-end locations using the point-of-care tests via the CLIA waiver. This is essentially the reason why we haven't rolled out into California yet. We are still looking at opportunities to do so under the current framework, but I certainly support the board's position, hopefully, to move forward with some advocacy efforts to clear up the remaining pieces that are prohibiting pharmacists from doing so.
All right, this is the moderator, and I've muted Lori. We'll move on to the next individual who has indicated they would like to make public comment. Individual identified as Holly Strom. All right, Holly, you will be given 2 minutes to speak, and I am unmuting your microphone now.
Hi, this is Holly Strom. Can you hear me?
Yes, we can hear you.
Terrific. I agree with what Stacy said, that we need to get pharmacists the ability to be the lab director for a CLIA waiver versus having to go to a physician and have them take on the liability of being your medical director for the CLIA waive tests. The other thing that I didn't hear anybody talk about was that this antigen, CLIA waive test for COVID-19 is a blood test, and it requires a special kind of analyzer. And not every pharmacy has that, analyzer. So I know of one client who actually has purchased the analyzer that can run the single CLIA waived antigen test that has been designated under an EUA by the FDA. That was a big mouthful, I know. But anyway, this person has, but it's not cheap. It's like $3,000. And as far as running the test is concerned, the place where you buy the machine, they will train all your staff and tell you exactly how it has to be done. So that part of it is once you buy the machine, you get all that training. And then finally,
30 seconds.
Oh, okay. I just wanted to bring up the point of pharmacist liability insurance. Everybody who's thinking about doing this, regardless of whether it's under an EUA or it's CLIA waived, pharmacists should check on their liability insurance to see if it will cover them in doing this test if the governor issues an executive order, for example. I'm done. Thank you.
Yeah, moderator is good that you give him 30-second warning. It's good because that gives him chance to finish the sentence. That's good.
This is the moderator. Thank you. All right, I've muted Holly. We'll move on to the next individual. Individual identified as Stephen Gray. Stephen, you will be given 2 minutes, and I'm unmuting your microphone now.
Thank you very much. I want to make 2 points. The first point is that with the opening up of healthcare, there are going to be a lot more testing needed. All the optional or elective surgeries are all being done only after the patient has been tested, and often tested several times. And so Washington State, for an example, where I have a surgeon brother-in-law, has a major problem with the backup in testing. As Mr. Martinez from CPHA said, we are really short. The second thing you may not know about, because of the lack of ability to perform the tests in a timely manner, that is, actually perform the tests on the specimen, some counties are prohibiting private entities, including physicians and surgeons, from doing their own testing. They require them to refer anyone who wants a test to the county. And so that gives you an idea of how serious the problem is with adequate sites that can actually perform the test. And after, back to my first point, after medical care opens up again, it's even going to get more serious in terms of being able to perform the tests. So we need pharmacies, perhaps others, to be able to perform these tests. Thank you very much.
Yeah, I agree with Steve. This is Albert. Because the reason I took the test, because I was doing a stress echo test and have a cardiology appointment. They require me to take the test before they can see me. So I hear what Steve's saying, that I think we will get more and more requests for the testing in the future.
Hey, Steve, do you know why, if I understood you right, you said some counties are requiring patients to get the test directly from the county. So do you have a feel that they would allow pharmacists to also perform the test? I mean, let's say the governor did this waiver. I mean, do you know why they're limiting it? Moderator, is Dr. Gray's mic still on?
Oh, apologies. Yes, I had muted his mic. If you'd like, I can go ahead and unmute him again.
Yes, please.
Right.
Yes,
Stephen, you are unmuted.
Thank you again. Yes, that's precisely the problem. They will not allow pharmacies to even send in the samples, not just pharmacies, other healthcare practitioners also, because it's overwhelming the laboratories in their ability to perform the tests and so forth. There are so many people who are wanting tests, maybe they're not even symptomatic, but it's delaying tests that are requested by hospitals and county officials. So there is actually at the local level an inability for tests to be actually analyzed after the specimen is collected.
Ah, interesting. Thank you for that.
Albert, you know, doing a test is one thing, but if make sure that when we do the test, it's recognized by the other health profession. Otherwise, if they don't recognize it, it's useless. I mean, like for my test, if I go somewhere do the one I did with the Stanford medical group, so my cardiologist from the same group, so they recognize the test. But if you go someplace they don't recognize the test, it's useless. So make sure that when the pharmacist is doing the test, that they will be recognized the result.
Okay, thank you, Albert, for that comment. Moderator, are there any more? Is there any more public comment?
Yes, we do have another individual. It sounds, sorry, I'm also looking at our background Teams chat. Ann Sodergren, we did have another question from someone who already made a comment. Should we ask the chair if that's allowed?
Yeah, we don't normally do serial commenting, so we would pass.
Okay. In that case, we will move on to the next individual who has indicated they would like to make a public comment. an individual identified as Keith Yoshizuka. Keith, I am unmuting your microphone now.
Very good. Thank you. I just wanted to, I did some quick research, and Business and Professions Code 1206.5 A sub 11 says that a pharmacist is defined in section 436 if ordering a drug-related therapy test is can qualify to be a laboratory director. So that is existing law. That passed in 2012 and went into effect in 2013. Again, that's Business and Professions 1206.5 A11.
But you said that's if they're ordering drugs, so that's not for a diagnostic test as this is, correct?
No, it's a CLIA wave test, but it's specifically for tests for what do you call monitoring efficacy and toxicity of drug therapy, and that's as Dr. Stein pointed out earlier, that's the current restriction under the statute in 4052.
Okay. Okay, moderator, are there any other public comments?
This is the moderator. Looks like that was the last individual who has indicated they would like to make public comment. Would you like me to close the Q&A feature now?
Yes, please.
All right, the Q&A feature is now closed.
Thank you. Albert or Cheryl, are there any other comments that you'd like to make? If not, I'm going to, I think we'll have a break for like 10, 15 minutes, and then we'll move on to the next agenda item, which is agenda item 5.
Yeah, I got no comment.
Okay, yes, I'm fine. I have no more comments.
Okay, so by the clock on my computer, it's 11:24. So how about if we reconvene at 11:40?
Okay.
Thank you.
All right, this is the moderator. We will be taking a break and reconvening at 11:40. Just as a precaution measure, I will go ahead and just mute everyone on the line, just so we make sure no one's lines are unmuted. Thank you. Notice that legal counsel Noreen Marks has dropped from the call, and it looks like she hasn't rejoined yet.
Ms. Sodergren, are we okay to go ahead and resume without Ms. Marks, or you prefer that we wait?
So I believe that you can. I think if any legal challenges or, if there's any questions that we're unable to, we can either move on and circle back when Ms. Marks is able to rejoin the meeting.
Right, and this is the moderator. I will keep an eye out for her and make sure that she's promoted to a panelist when she rejoins.
Thank you very much.
Albert's back.
Okay, I'm moving on to agenda item 5, which is the update on implementation of SB 159 related to the HIV pre and post exposure prophylaxis. So there was some information in the board meeting materials. And the board is working on development of our own board training program in collaboration with the subject matter experts, including folks from the Office of AIDS. Although development activities have been slowed down in response to the COVID-19 pandemic, the board staff is hopeful that the framework of the training program will be available or completed for the board's consideration during our full board meeting at the end of July. Consistent with the emergency regulations, a training program must either be approved by the board or be provided by a provider accredited by approved accreditation agency, including ACPE or the California Pharmacist Association. I have been advised that California Society of Hospital Pharmacists, CSHP, is finalizing a training program and intends to launch it later this month. The board has not to date received any requests for a board to approve a training program. Members, are there any comments or questions on the status of SB 159 training programs?
No.
Chairperson Veal, I apologize for the interruption. Would you mind doing just a quick roll call since we are back from break, just to confirm the members are present? Thank you.
Thank you, Ms. Sergren. I apologize. That was my lapse. So let me go ahead and do roll call. Albert Wong, I believe I heard you speaking.
And Cheryl Butler is here.
Okay, so thank you, Ms. Sodergren. We do have quorum, and the 3 committee members are on. And with that, Cheryl, did you have any comments that you wanted to make on agenda item 5 and the status of the training programs for pre and post-exposure prophylaxis?
No, I do not have any comments.
Okay, moderator, will you please open the lines so we can entertain any public comment?
This is the co-moderator. At the direction of the chair, I have opened the Q&A feature for public comment. If you would like to make a public comment, please click on the icon with a question mark located at the bottom center of your WebEx screen. I am currently sharing the instructions on the screen for your reference. As a reminder, if you are a member of the public and would like to participate in public comment, must enter via the WebEx event through the link provided in the agenda. In the Ask field, typically in the lower right corner of your WebEx screen, type, I would like to make a comment, and send it to all panelists. Any other communications will not be responded to. It is not necessary to identify yourself in order to make a public comment. I will be taking the comments and the order that they are received. Please note that the Q&A feature is being used only as a means for the members of the public to represent that they would like to make a verbal comment. Once unmuted, the members of the public may verbally state their comment. This is not a means to ask questions of the moderator or members of the board. Such inquiries submitted using this feature will not be answered. I will now pause for a moment to give members of the public time to access the Q&A panel and submit their requests. I have an individual identified as Keith Yoki Zuka, and I apologize if I mispronounce your name there. You will be given 2 minutes, and I will provide you with a 30-second warning. I'll let you know once your microphone has been unmuted. Keith, your microphone has been unmuted.
Very good. Thank you. Keith Yoshizuka, President-elect for CSHP. As was mentioned, we will have a live event during the evening of July 29th, which is an ACPE accredited program. It will be recorded, and we'll probably follow up with another live recorded session, and then edit those two, selecting the best passages, and then have a web-based presentation posted on the CSHP website. The program is free to all pharmacists, don't have to be a CSHP member, and is being presented by 5 qualified experts in the field of HIV medicine. We tried to keep it 90 minutes, but with everything, particularly with instruction on how to talk to a patient about sexual health, it's probably going to edge closer to 2 hours. Total time involved to develop the program was about between 80 and 100 hours of work went into this project. So we're hoping that it's a success. Thank you.
Dr. Yoshizuka, first off, this is Chairperson Veal. I appreciate, that you guys are jumping out of the gate and getting this program ready to go, and really appreciate that you are planning to have it free. I think that, I know the bill author, Senator Wiener, really wanted to increase access and do that through pharmacy, and so I applaud the efforts of your organization.
Committee Chair, no
co-moderator, Is there any other public comment?
No further requests. Would you like me to close the Q&A feature?
Yes, please.
It has been closed. Thank you.
Okay, I am going to move on to agenda item number 6, discussion and consideration of a proposal to develop a temporary closure status and mandatory notification requirement for board licensed sites. For the past several years, typically in response to declared disasters, but also in response to construction issues, the board's licensed businesses at times must temporarily close. More recently, regrettably, a significant number of the pharmacies were damaged or destroyed. And in many instances, the damages occurred to a number of pharmacies in the same region. Although not required, some facilities did notify the board when temporary closures occurred. Such notifications allow the board to maintain a better operational history, although it is in an informal fashion, and provide transparency to consumers, licensees, and other healthcare practitioners through our website lookup. For policy consideration today, as a committee, we should consider if we believe establishing a requirement for notification of temporary closure status is appropriate. Requiring notification would ensure consistent reporting requirements for businesses licensed by the board. Further, notification of closure would allow the board to plan inspection activities and ensure licensees and consumers have current operational status information when using the license lookup. So for our consideration, should we agree in concept with the policy, the meeting materials include a proposed language for regulatory change to facilitate the requirement. And if you have the meeting materials handy, it would be in attachment number 4.
Yes, Debbie, I see attachment 4, 1708.1, notification of temporary closure.
Yes.
I do feel that I would support that.
And just because you brought it up and you actually did the number, I'm just going to read. It's 1708.1, notification temporary closure. A permit holder shall notify the board of any temporary closure of facility that will exceed 3 consecutive calendar days. Closure dates will be public information.
Yes.
Albert, do you have any comments?
No.
Are you in support of this of the proposed language?
Yes.
Would Cheryl or Albert, would you like to make a motion?
So moved.
And this would be a motion to the committee would recommend to the full board the concept of the policy or I'm sorry, I'm kind of stumbling over my words here. We'd recommend to the full board the proposed language be moved
To initiate.
to the process.
Yeah, to initiate a rulemaking.
Okay, thank you, Noreen. You're back.
I'm back.
See, we do need you.
Yay.
And I would second that motion.
Okay, great. Co-moderator or moderator, please open up the lines for discussion from the public or comments from the public.
All right, this is the moderator, and at the direction of the chair, I will go ahead and open up the Q&A feature now. Members of the public, if you would like to make a public comment, please click on the icon with a question mark in a square located at the bottom center of your WebEx screen. All right, and we do have one individual who has indicated they would like to make public comment. Danny Martinez, I will go ahead and unmute your microphone and you will be given 2 minutes to speak. You are unmuted.
Thank you. Danny Martinez with the California Pharmacist Association. We don't have an official position on this proposed regulation. I do want to note, however, concerns about the way this is written. Taking into account when a pharmacy violates any sort of regulation, there's always enforcement that comes with it. And I'm not sure how, in a real world situation, particularly given, like, I'll just use COVID as an example because that seems to be the topic of the day. If there's a pharmacy that doesn't know if there's going to be closed for a period of longer than 3 days because they don't know, either they're waiting for a test, as we've mentioned before, or through some sort of other issue, what kind of discipline are we looking at? If there's no, this regulation doesn't say, you know, it has to be on the third day, when, you know, after the 3 days, what happens if it's 4 days and we didn't know? I mean, there's a lot of questions that I would very much be concerned with the lack of specificity here. And again, I want to reiterate, we don't have an official position. We may have one at the full board meeting, but that is something that as we're reading this would immediately come to mind.
You know, Danny, I think our intent is not to be punitive, but to be, you know, make this information available for the public. And I think, you know, what we've experienced with the natural disasters as well as the civil unrest of the, you know, recent days.
Right.
That, you know, we're just trying to, you know, have public, you know, make it available for the public. And we, you know, did feel like, you know, if it's going to exceed 3 consecutive days, that's a significant enough time that someone would know, hey, I'm kind of closed for a while here. So that, you know, we selected that 3 consecutive days because we thought that was a significant amount of, you know, enough time that it was reasonable. But, you know, our goal is not to be punitive. Our goal is for, you know, consumer information.
Understand, and that's literally.
I agree with that very much.
Yeah, and I understand. We're not saying that we oppose this right now. Again, we may have further comments at the full board meeting. I just wanted to bring those concerns to light as this goes to the full board.
30 seconds.
Because this is obviously going to be something that our members are very much concerned with. If on top of looting, rioting, COVID, they have to worry about potential board discipline for violating this, clearly something that we probably might need to rethink. So again, I'll have more comments at the full board meeting likely, and just wanted to make those concerns available right now.
Thank you for sharing. Well, moderator, are there any additional public comments?
Yes, this is the moderator. We do have another request for public comment from Stephen Gray. Stephen, I will unmute your microphone and you'll be given 2 minutes to speak.
Thank you very much. I'm speaking on behalf of CSHP, and from personal experience, it has always been confused over the years what the board policy was regarding temporary closures. And I do think this is a good start to open up that discussion. And as Mr. Martinez said, of course, this is going to go through the board meeting and through the regulatory process, and we can get further clarity there. I just would like to point out that under current section 4312E, the board already has statute that says the board may close a pharmacy if it hasn't been open for at least 1 day each week during a 120-day period. And there have been problems with that particular. I realize that it allows the board to close a pharmacy or cancel a license, but it doesn't require it. But there are many instances where this has come into play, some of which have been as simple as the sole proprietor ownership of a pharmacy who is sick and the family doesn't know what to do and they can't keep the pharmacy open. So there's a lot of discussion that needs to happen, as Mr. Martinez said, about the circumstances. Okay, now we have notified you. What do we have to do? And so the board needs to be thinking ahead of what type of guidance should be provided once the notification goes out, depending upon the individual factual situation. But it has been a security.
30 seconds.
Thank you. It has been a security issue sometimes, and it's important for the public to know what they're supposed to do when they find out their pharmacy is closed, and how do they get their meds, how do they get their records, et cetera, et cetera. So thank you very much.
All right, this is the
And
moderator.
Dr. Gray, thank you for your comments. I think it sounds like a FAQ might be attached to this, as we move down the road.
All right, this is the moderator. That was the last individual who has indicated they would like to make public comment. Would you like me to close the Q&A feature now?
Yes, please.
All right, the Q&A feature is now closed.
Okay, board members, we have a motion with a second on the floor. I would like to, I'm going to take roll call for the motion. Cheryl?
Ms. Veal, can I interrupt for just a second? I just wanted to address what Mr. Martinez had said and what you had said about while the intent is not to be punitive, any violation could be a basis for citation or something. But in order to provide that clarity, now that the language does say the permit holder shall notify of a closure that will exceed. So in my opinion, that means prior to the understanding on the part of the permit holder that it will be closed for a period that exceeds 3 consecutive days. But did you want to add something in there about that to make that clear? So if the expectation is we're only going to be closed for 3 days, and then you get to the end of that 3rd day, you realize you're going to be closed, if that is the trigger, somehow that indicates prior to the understanding or some language around that.
What if we said that has closure of a facility that has exceeded 3 days?
That would be okay because it's clear, except let's say you're closed for 2 weeks. So do you mean as soon as it has exceeded that 3rd day, on the 4th day? Because if it just says if it has exceeded, it could be any time after it exceeded. So I just want to.
How about if we say once it has exceeded 3 days, 3 consecutive days?
Yeah, I think you still want to tighten that up a little bit, like as soon as it has been closed for more than 3 days or something along those lines.
Could we add to our motion to give the authority to the executive officer working with the committee chair to fine-tune the language before we proceed to the board?
Yes, as long as that's the clear policy that you want the notice to be given either prior to the closure, if the permit holder knows it's going to exceed, or if it doesn't know it's going to exceed and then finds it is as soon as they have that knowledge. So if you want to make that policy clear, I think we can then go ahead and tweak the language a little bit.
Cheryl, Albert, I'm thinking we want it to be that once the 3 days have occurred, because I'm not sure people are always going to know that they're going to be closed, ahead of time. So I think this is more like in disasters and stuff, or even like in the civil unrest. I'm thinking that once it's been closed 3 days, at that point, then they're obligated to let us know.
Yeah, I agree with that, Debbie.
I also agree with that. So after 3 days, if they need a little more time, then they can inform the board, and then we could extend it.
Okay, so are you guys modifying your motion to reflect that?
Yes, I could do that. Yes.
Okay.
And I would second that.
And that modification also includes that, or maybe it was already in the original, that we give the authority to the executive officer to make non-substantive changes following this policy. Okay.
And I'm hopeful that it also includes working with the committee chair to make sure that I capture it correctly.
Okay.
Yeah.
That's good, Albert. Are you good with those?
Yeah, And I make sure Ann understand that we need to work together with the licensee. Like Debbie say, we not intend to punish them. It's just for informational.
Cheryl, you okay with the second?
Yes, I certainly am. Because it is just letting us know if it's going to exceed 3 consecutive days, and I'm thinking that with you and Ann can fine tune it.
I'm going to call for the vote. Albert, how do you vote?
Yes.
Cheryl?
Yes.
And I'll vote yes also, so it's unanimous. Okay, I'm going to move on to agenda item 7, which is discussion and consideration of proposed amendments to Title 16 California Code of Regulations, Section 1704, change of address. The board has previously indicated its preference to streamline communication with applicants and licensees. Communication through email is an efficient way to communicate with applicants and licensees. However, there is no requirement for applicants and licensees to provide the board with an email address, nor maintain an address when changes occur. Board staff is requesting that the committee's consideration of a regulation change that would require an applicant or licensee to advise the board of a change in email address if they have one. Such a proposal would facilitate better email communication notification with the applicant and licensees who maintain an email address with the board. Included in the meeting materials is attachment number 5 and the suggested language that would be used to implement such a policy change if deemed appropriate by the committee and the board. So looking at attachment 5, we're changing 1704, change of address, adding subsection B to say, each applicant and person holding a certificate, license, permit, or registration who has an electronic mail address shall provide to the board that electronic mail address and shall maintain a current electronic mail address, if any, with the board. And C, failure to comply with the requirement of this section may subject the person holding a certificate, license, permit, or registration to enforcement action. So let me, first I want to ask the board members your thoughts on this request by the staff. Cheryl.
First of all, I have one question. Is this something that's going to be published, or this is just information that the board will have on everyone?
Ms. Berggren, can you respond to that?
With your approval, I'd like council to actually respond to that.
Sure. I think any information that the board holds on any applicant or licensee would be subject to the Information Practices Act, as well as any of the documents would be subject to the Public Records Act. So generally, when the board is asked for documents or information about a licensee, sometimes a portion of it, the document may be public, but certain information is considered personal information and is withheld under the Information Practices Act. So addresses of record would be public, but I think personal information such as a home phone number or an email address, I would say it would be probably considered personal information under the Information Practices Act and would not be provided. So let's say you have an application for licensure and it includes that information. The application for licensure may itself as a document may be public, but information such as social security number, date of birth, email address, home phone number, that information would not be provided.
Thank you. So, with knowing that, I certainly believe that with email, it's definitely faster, and I can see a lot of advantages to the board having our emails as a way to be able to communicate. So I would support it.
We should treat the email address just the same as the phone number.
Right. I think that's what Ms. Mark said.
Yeah, I understand. I definitely appreciate that. So that's why I'm okay with supporting.
I'm sorry, I could not hear what Mr. Wong said at all, so I can't respond.
Mr. Wong said that he thought that the email should be treated the same as the phone number, and both Cheryl and I understood you to say that that's correct, that an email and a phone number would be treated the same and not released.
I would consider a personal email address as personal information that would be withheld under the Information Practices Act.
So, Albert, do you have any, it looks like you unmuted yourself, so do you have any further comment you'd like to add?
No, I'm okay.
Cheryl, would you like to?
Well, here's one thing, Debbie. Excuse me. I see that failure to comply with the requirements was subject a person holding a certificate, a license, permit, or registration to enforcement actions. It's like if you give an email and unless something happens, you have to change your email, you would update that information with the board. But someone who's not given an email at all don't have to worry about that. So the only question I have is the fact this enforcement action part on the end is would that cause somebody to not want to give an email at all? I mean, I just want you guys' opinion about that too.
Yeah, so I have a couple thoughts. First off, I think if you have an email, the way I read it is if you have an email, we're asking that you provide it. This says that who has, so any applicant who has an electronic email shall provide it to the board. So by not providing it, I think that that would be an issue. I guess the only reason you have to have C is so if someone doesn't update it or doesn't provide their email, if you don't have C, then maybe there's no teeth. And I don't know if we, I can't imagine we're going to take someone's license away because they don't give us their email, but I think we need to have something that we can, go back to them and say, yeah, this is not okay.
Okay. All right. That's why I wanted to just get someone else's opinion about it.
Yeah, I don't know, Ms. Marks, I don't know if I represented that well, or if you want to make any comment from your point of view.
Whether or not someone is going to not provide information because of that, I couldn't say. I think most people in filling out the forms probably like giving that information because it's a better way for them to receive information. Enforcement action does not necessarily mean discipline. I've seen citations for failing to change addresses, but I don't think I've ever seen discipline for it, but that's truly within the discretion of the board, board staff. So if you've got a general provision, and I'd have to quick look to see that it says violation of any provision of the act or the regulations promulgated pursuant to it, may be a basis for enforcement action, then you don't need C, but you have the same impact, which is that people need to provide information and they need to keep it current. in this case, they need to provide information if they've got it. That doesn't require you to have an email address. It just requires you to provide it if you want one. If you have one, and then to keep that up to date. And I think maybe staff can speak as to the issues they have when they don't have information that's up to date. Does that help?
Ms. Marks, are you saying that we do need C in there, or are you saying that that's already covered elsewhere in the regulations?
I'm not sure. I'm taking a quick look to see if it's covered somewhere else in the regulations. It essentially has a general provision that says license holders have to comply generally with the provisions of the Act and the regulations promulgated to it. If you have that, then it's already covered generally, and you don't need C, but you have the same impact. So just FYI, just if we take out C, there may still be a basis for citation or something else if there is a violation of the provisions. So I'm going to take a quick look while we're talking.
Okay.
Yeah, this is Albert. Well, I think the board is busy enough, so we make sure Ann has got the messages. This is not enforcement, not a priority for her.
So this is Anne. Yeah, I totally understand and agree with, everything that you're saying and the sentiments that are being conveyed as well. I think that there's a lot of reporting obligations on the board, for licensees to maintain information that's current with the board, because that really is one of the ways that we facilitate communication, especially the address of record and how we, use that for filing documents and everything else. So I'm not quite sure that C is necessary, but we can check. I believe that, when we need to be able to have a way to communicate readily with our licensees. And as, the committee has expressed, and the board itself, the desire to go a little more paperless, this seems like a very straightforward way to facilitate that, at least in a limited fashion, more so than the tools that we have right now. So we can, if the committee is agreeable, look at, if the committee has support for it, look at moving forward with the proposal with the understanding that staff can confirm with council whether or not the provisions of C are even necessary. My initial thoughts are that it is probably not.
Thank you.
Cheryl, would you like to make a motion?
Yeah, I'd like to make a motion that that we proceed with 1704, providing email addresses. Each applicant holding a certificate, license, permit, or registration who has an electronic mail address should provide to the board that electronic mail address and shall maintain a current electronic mail address, if any, with the board. That's my proposal.
Sorry, I keep interrupting. I apologize. Cheryl, just to confirm, the recommendation would be to recommend to the board initiation of a regulation change as detailed in 1704.
Yes, thank you.
Thank you.
And I guess, and Cheryl, you're recommending that we move forward without the proposed C unless the executive officer and legal counsel determine that it's necessary.
Absolutely. Thank you.
Second.
I can just add in that 1775 of your regulation, 1775 sub A2 says that the executive officer may issue a citation which may contain either or both an administrative fine and an order of abatement for violation of a regulation adopted by the board. So you do have clear citation authority.
Okay, that takes care of
He
that.
said it may, so I just want her to not make it into a priority.
Okay, and Albert, I heard you second it, correct?
Yes, I second it.
Okay. All right, moderator, would you please open up for discussion for public comments?
All right, this is the moderator. I will go ahead and open up the lines for public comment. All right, members of the public, you can access the Q&A feature by clicking the icon of a question mark within a square located at the bottom center of your WebEx screen. Currently have instructions up on the slide for your reference. All right, and it looks like we have one individual who's indicated they would like to make public comment. Stephen Gray. I will unmute your microphone now and you will be given 2 minutes to speak. All right, and your microphone is unmuted.
Thank you very much. First comment is it would be important for the board to say what the intent of this is. We would be very concerned if the email was to substitute for the address of record for official notifications and so forth for a variety of reasons, including the reliability of some email systems. But secondly, the statute 4013 already requires every licensee and every permit holder of a facility to supply the board with an email address and to update it within 30 days of any change. The only thing that this proposed regulation seems to do then is to add a similar requirement for applicants. And so we're wondering if given the statutory requirement that already exists, whether this is even necessary as it applies to licensees or to permit holders. And would ask that the board not approve the motion until that is clarified on both counts, whether it's address of record, which has big consequences attached to it, etc. Also, there is a possible conflict with the statutes that are referenced with the regulation in that there's nothing that says that the board is allowed to collect email addresses, which may be, moot because of 4013 as it applies to licensees, but the statutes reference don't indicate email addresses as something that the
30
board.
seconds.
Thank you very much.
All right, this is the moderator. I have muted Stephen's mic, and we'll move on to the next individual who has indicated they would like to make public comment. Robert Stein. Robert, you will be given 2 minutes to speak, and I am unmuting your microphone now.
Thank you. I won't need 2 minutes. I would just suggest if this proposal is going to move ahead, that authority cited should include 4013 and Business Professions Code. Thanks.
All right, I've muted Robert. And it looks like that is the last individual who has indicated they would like to make public comment. Would you like me to close the Q&A feature now?
Yes, please, moderator.
All right, Q&A feature is now closed.
Thank you very much. Ms. March, do you agree with, I believe, what Dr. Gray said, that 4013 already requires email addresses and for them to be updated?
I'm taking a look at that. My understanding was that there's a difference between saying that the licensee needs to be on the board's email notification list versus giving the board the address itself. So the board has it versus being on the so the board has it as part of its information versus being on the listserv, which is not a database that the board can access. So I believe those are two different things.
Okay, thank you. And then his comment to intent. And do we normally indicate intent in our regulations?
In the language of the regulation, not generally.
Yeah, okay.
Sorry, this is initial statement of reasons, the ISR. We is where usually the policy is set forth.
Okay. Okay, I'm going to do a roll call for a vote on the motion. Albert, how do you vote?
Yes.
Thank you. Cheryl, how do you vote?
Yes.
Thank you. And I'm going to vote also, so unanimous that we're going to recommend moving forward to the full board. And thank you, public, for your comments. I am moving on to licensing statistic, agenda item number 8. This is our last item to review, and the meeting materials highlight some of the data points as of June 24th, 2020. Additional annual report information is provided in the attachment where possible. As of June 24th, the board has received 12,594 initial applications and received 508 requests for temporary site applications. As of June 30th, the board has issued 9,192 individual licenses, 2,087 site licenses without temporary license requests, and 445 temporary site licenses. Also is information on the processing time, and it includes a comparison to previously reported data. I noticed that the processing time for all applications are at or below 30 days, and further, with the exception of 3 application types, the processing time for deficiency mail is or at below 10 days. So that's, happy news, happy that we, now are getting to the point where, we're getting very close, and so we appreciate all the efforts that the staff has made to get to this point, especially in the current environment, that's been thrown at us. I know some staff has had to work at home, so it's been very challenging. So we appreciate that they've been able to wrap their arms around these situations. These are very important to the licensing committee. Other members, I'll go with Cheryl first. Cheryl, do you have any comments on any of the licensing statistics that you'd like to share?
I just have a question. When I see current, is that current? Because when I look at the comparisons, when they talking current, are they talking within the 30 days?
If I any current means that we do not have any work in that area, we are current with everything that we received.
Wait, I didn't. That wasn't clear.
Yeah,
this is. So this is Anne. Can you hear me okay now?
This is the moderator. Anne, do you mind speaking one more time?
This is Anne. Can you hear me?
We can hear you, but your audio is really distorted. Do you want to try connecting through your phone?
Sure, but that would take up some time for the committee. Is it better now?
You still sound pretty distorted, and it is a little hard to understand what you're saying.
Okay, nothing has changed on my end. I can try, but it'll take some time to do so.
This is the moderator. Sometimes this happens when I apologize. I muted myself and I was talking. Anne, do you mind speaking one more time?
Yes, I'm still on. Can you hear me now?
Your audio still sounds pretty distorted.
Okay, I'll try to connect my phone.
Moderator, sometimes when try to connect to the computer.
This is the moderator. I went ahead and muted Everyone, I think Anne's audio might be having a feedback loop, so I will go ahead and let her reconnect her audio through the phone. And real quick, I will go ahead and get those instructions up right now. So please give us one moment while Anne reconnects. All right, Anne, do you mind unmuting your microphone so we can make sure that your microphone's working properly?
Is this better?
Oh my gosh, yes, we can hear you much clearly.
Okay. So Cheryl,
Thank you so
sorry
much.
for all of that. Yeah, I think you're going to be, yeah. So essentially current means that we do not have any workload in that area. We are current with processing everything that has been received.
Cheryl, you're still muted. Do you want to respond?
Okay, yeah, no, I just told her, thank you for explaining that. And I agree with you, Debbie, the processing times, especially under these conditions are really good. Thank you.
Albert, is there any comments you'd like to make?
I don't have any comment on the licensing, but like Cheryl said, you know, really appreciate the speed of processing all this licensing, and also disciplinary cases. Also, you know, we see it. You know, we resolve it pretty quickly, or take action pretty quickly. Instead, like before, it takes a long time to bring the case up. So we commend the board is doing a good job on that. And also, before we are leaving, I would like to hear from Ann what's the latest on all those pharmacy being looted. And I know that quite a few pharmacy around in our neighborhood is still not opening, or if they open, they only open a very short time. But I know some of them is not still unable to open. So I just like to hear some status on some of those pharmacies throughout California.
So Albert, Albert, that item is not on the agenda, but it is on the agenda tomorrow for the Legislation and Regulation Committee, Pharmacy Security. So we do have some information there, but I'm happy to give you a call as well. We have public ed in about a half an hour, but I'm happy to call you later and answer any questions.
No problem.
Okay, moderator, can you please open up the lines for discussion of for public comment?
All right, this is the moderator, and at the direction of the board, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a public comment, please click on the icon with a question mark within a square located at the bottom center of your WebEx screen. We're currently sharing instructions for your reference right now. And at this moment, I will pause to allow members of the public time to access that Q&A feature. All right, this is the moderator. At this time, it does not look like there are any individuals who have wished to make public comment. Would you like me to close the Q&A feature now?
Yes, please.
All right, the Q&A feature is now closed.
Thank you very much. The last item on our agenda is agenda item number 9, and that is future committee dates, which is October 27th currently. I guess it could change. We'll see. We've got a lot of items on our agenda, our potential future agenda items. But with that said, I would like to thank the members of the public who participated in the meeting today, as well as my fellow board members and staff and our moderator. I think it went fairly smooth, considering our situation and having to hold meetings via WebEx. So thank you very much, and I will consider this meeting adjourned.
Thank you, Chair. Excellent.
Sorry for me for the